I'm really excited to introduce Dr. Allison Herman, who is an associate research scientist in the Department of Health Policy and Management and associate director of the UCLA Kaiser Permanente Center for Health Equity, which is in the Fielding School of Public Health. And she's also the co-director for community outreach, education, and disparities at the Johnson Comprehensive Cancer Center. So it's a real pleasure to bring up my colleagues who will moderate the next session. Thank you.
Okay, thanks everyone. I am so pleased to be here, and I have to say, I am feeling really inspired and hopeful after those first two sessions, and it feels so good because I don't know about you all, but the past couple months have been a rough ride, and I'm having more hard days than good days. So this is a really great place to be, and I'm really honored to be here, and I'm excited for us to kind of come from this system level where we heard all these amazing things happening in Covered California and at County Hospital, and now to take it really to the community level and hear about some of the amazing things that are going on. So I have the pleasure first of introducing Rhonda Smith. She is going to be our first speaker, and then we're going to open it up into a panel discussion after that. I'd love to invite all the panelists to come up and have a seat here right now. I think that'll help us go most smoothly. And I'll introduce Rhonda. Rhonda currently serves as the executive director of the California Black Health Network. It's a statewide organization that advocates for health equity for Black Californians, and she's going to tell you a little bit more about the mission of the organization, but they are really working to ensure that all Black Californians have access to high-quality health care and can live long, healthy lives. And she's had a number of really critically important roles prior to this. You can read her bio by scanning the QR code on your agenda that you have there on the table. I don't want to take too much time away from her. I want her to be able to share all of her wonderful stories with you. So with that, I'm going to pass it over to Rhonda.
Thank you, Allison. It's so nice to be here. I was here last year as a attendee, and nice to have the opportunity to talk about some of the work that we're doing at the California Black Health Network. Also nice to see so many familiar faces in the audience, and then one I haven't seen in about 10 years, Jeanette, so nice to see you again. So I'll talk about the work that we're doing at the California Black Health Network, and when we talk about navigation, I'll talk about it in that context, but we're really strong proponents of self-empowerment, self-advocacy, and self-navigation. So I'll talk about some of the programs and initiatives that we have in place that focus on that for our community. But first, I'll tell you a little bit about the organization and who we are. If you haven't heard of us, we've been around for more than 40 years. Despite the gray hair, I haven't been around with them that long. This has only happened in the last 4 years that I've been there. But we are the voice and trusted resource for Black health equity here in California, and we are the only Black-led statewide organization that really works to advocate to advance health equity, I'd say for all Black Californians, including African Latino immigrants and Caribbean immigrants. There are other Black-led organizations here in California that do work specifically focused on gender issues or either specific health issues, but we cover a broad spectrum of health issues and conditions for our community. What we do is really conduct outreach, education, advocacy, and policy work, as well as programmatic work to really try to close the gap in health disparities for our community. And we do that through the lens of the intersection of social justice, racial justice, and environmental justice. I mean, that is our health equity framework, and it really is the platform for the work that we do. And so our vision is very aspirational. We hope through our work that we can create a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from racism, violence, and as well as health inequities. And we do that every day through our mission to ensure that every Black Californian, no matter who they love, how much money they make, where they live, how they self-identify, where they're from, really has the opportunity to access high-quality, equitable primary as well as behavioral health care, and definitely avoid succumbing to disease unnecessarily, and especially those that are preventable. And so what we do around navigation, I want to start by talking about the work that we do with Covered California. I'm happy to report that this is our 10th year of being a Covered California navigator. Sorry, Dr. Soni's not in the room. Have had the pleasure to work with her on a couple of occasions, but we've, over this past year for this enrollment period, we've actually doubled the number of certified enrollment counselors we have across the state. And now we can truly say we have statewide coverage from Fresno to Sacramento to the Bay Area, all the way down to San Diego and over to the Inland Empire. And so the majority of our certified enrollment counselors are in Southern California, but really distributed across the state regionally, as I mentioned. And then even though we really focus our efforts on the Black community, we are very inclusive. So anyone who needs access to health insurance, we will support and enroll and navigate them through that process. So you can see that actually the majority of the individuals that we do enroll in healthcare coverage are Latino, but a very diverse base of individuals. And something interesting as I was gathering data, I noticed that 34% of the people that we did enroll in this open enrollment season, starting November 1st, chose not to really identify themselves racially. And I think the underlying thing is probably because of the new administration and not being able to be identified for who they are or where they may be from. So that interesting statistic or data there. And then when we look at the number of enrollments that we were able to achieve in 2024 calendar year, it was about 588 people that we were able to enroll in qualified healthcare plans and about 124 in Medi-Cal. And then just geographic distribution, again, kind of mirrors where we have our highest concentration of certified enrollment counselors, mostly in Southern California, but again, we are statewide, and you can see that distribution here. And so I told Dr. Tony that I co-opted one of her slides from her presentation because I thought it was really interesting. Great to see that we have about 98% of Black Californians insured through Covered California. I wanted to point out a difference between, like, we're at 2.1 in terms of the number of uninsured Black Californians now compared to, say, 4.5% for the AAPI community. But when we look at health outcomes, you know, we see that life expectancy for Black Californians is the lowest in the state. That's 74.6, almost 75 years compared to about 86 years for the AAPI community. So despite the fact that we have a high rate of insured individuals here in California, we're still seeing poor outcomes. And in some cases, still no improvement, especially when we look at what's happening in maternal health. And so we could have a whole symposium on why that is happening, but not today. I'll just give you the highlights. And so some of the challenges that we see in addition to poor outcomes is access and utilization. We know that there's some areas where there are lack of resources or what we consider as medical deserts. So even just getting their basic needs met or having a primary care center or FQHC to go to isn't always easily accessible. And you know, transportation in LA is not the greatest, as I'm sure all of you experienced this morning just to get here. And so, you know, the big elephant in the room, I want to say in this case, is also racism. We know that a lot of our community often avoid going to see physicians or interacting with the healthcare system because of their past experience and also because of historical consequences that have happened throughout history. Also, there are insurance hurdles, and if you're not very savvy, or like a lot of us in the room, know how to navigate through that situation, it can also become a burden or very difficult just to get basic things covered. I had my own personal experience recently when I went to get my mammogram and had to get an ultrasound and had to negotiate with the insurance company to get that covered. But again, not everybody knows to call to get pre-authorization, or that, you know, you should be able to get a lower copay with your ultrasound, especially because of the dense breast law. So Yeah, it's important to know those things and how to navigate through your health insurance as well. And then timeliness to care and treatment. I really want to applaud the work that LA General has done, because I know sometimes, and I'm sure Jen has probably heard these stories of women, especially in Medi-Cal, kind of waiting to get into treatment after a breast cancer diagnosis. And sometimes, that contributes to a poor outcome. So I'm really happy to see all the great work that LA General has done, and want to give them a round of applause for really, let's say, not just being intentional, but also providing more compassionate care and really embracing what patients' needs are and doing something about it. And then social determinants of health. We've heard that term come up a lot today. And it's an important part of, I would say, healthcare. When we look at social determinants of health, there's health behaviors, there's clinical care, there's also the social economic factors that come into play, as well as the built environment that our communities live in. And so when we look at the distribution and how each one of those factors contributes to health outcomes, really 80% relate to things that don't happen inside an exam room, inside a hospital or a clinic. So 80% really is about what happens outside of the four walls of any of those facilities. So social determinants of health and how they impact not just communities in general, but individuals who live in those communities is very important to consider as we are caring for patients. So those are some of the issues and challenges. I want to talk about opportunities and some of the things that we're doing to address some of these issues. And so, as I mentioned, we are a Covered California Navigator. We do a great job of enrolling people, especially that are uninsured, into coverage. But what happens if someone's new and like, okay, so I have the health insurance, what does that really mean? What do I have access to? So we've been working on creating some sort of education piece for our newly enrolled and some of the folks that we keep, enrolling in healthcare coverage, a training or educational piece about you're covered, now what? What do you do? How do you navigate through that process? So we will be working with our CECs to actually work with their clients that they've enrolled in healthcare coverage to walk them through that journey, that part of the journey. We have been doing a lot of work to improve health literacy. We really want to create a more empowered community of Black Californians who really take charge of their healthcare, are more proactive about that, and really take ownership of that, so that they can better navigate through the healthcare system, whether it's a hospital stay, an ER stay, a doctor visit, or even their insurance. They really become more savvy healthcare consumers as a result of that. And then local navigation, working with community health workers, allied health professionals, community-based organizations and resources can also be very helpful. Lay navigators also are very helpful. One of the things that we are working on is a Black provider and wellness directory, because we have been getting a lot of calls to our office about referrals to a Black pediatrician in San Jose, or a Black mental health therapist in LA, or another health resource in some remote area. And so we said, we are the Black Health Network. We should be able to connect people to these resources very easily. So we have a platform now that we're actually building. Well, we've built it, but we're trying to have more providers opt in so that we can be that one-stop resource for people who need doulas, a community health worker, a licensed clinical social worker, oncologist, whatever the profession is. We really want to take a more holistic approach to the providers that are in the directory and really make it a one-stop resource, no matter where someone lives in California. We also have done a lot of work in the area of policy and legislation. We are fortunate enough to have support from some of the major foundations here in California. Programs have been great. Programs have a very limited time frame. So I say programs come and go, but policies create lasting change. And we're very fortunate enough to work with the folks at City of Hope on a very important piece of legislation that I'll talk about right now. And that is SB 987, the California Cancer Care Equity Act. How many people in the room are familiar with that piece of legislation besides us? Just us. Okay. All right. Okay. So that's one of the challenges that we face. Policy, I think there are a lot of great policies here in California, but often implementation falls short. And that's something that we have been challenged with. I'm sure Dr. Albanaz can attest to that over the last couple of years. But the California Cancer Care Equity Act is really focused on closing the gap in the disproportionate number of Medi-Cal cancer patients in the Medi-Cal system who die more often than those individual patients with private insurance. And so with this new piece of legislation, patients really have the opportunity to be navigated to care at a cancer center of excellence here in California, get access to the standard of care, because oftentimes, unfortunately, the type of insurance will dictate what type of treatment or the quality of that treatment that a patient receives. Also, because of this particular piece of legislation, patients will get access to precision medicine, genomic testing, as well as get enrolled in a clinical trial, which does not happen in the conventional Medi-Cal system. So this is an amazing piece of legislation and a policy that I think will, over the next, hopefully 5 to 7 years, we'll begin to see a decrease in that disproportionate number of Medi-Cal patients with a more serious or advanced cancer diagnosis have better outcomes. And so this is just the coalition that we work with. So the Cancer Cares Different Coalition is comprised of many statewide organizations and other foundations in the cancer space. So really happy to be part of this great and amazing esteemed group of organizations to continue to work on identifying policy opportunities to address things at the system level that really can advance health equity for communities who are under-resourced. And so I want to talk about some of the work that we're doing, really what I refer to as navigation at the individual level. But for me, it really is more focused on patient empowerment. And so no matter if someone has access to a navigator or not, I think it is incumbent or really important for us to be able to advocate for ourselves, to be able to understand how do we navigate through the healthcare system as complex as it is. And so we are fortunate, very fortunate, to be a partner with the California Healthcare Foundation to implement some of the recommendations that came out of a major research project that they invested in about 3 years ago called Listening to Black Californians. And kind of on the heels of what was happening in the summer of 2020, and particularly the George Floyd murder, our program officer really led the charge in really wanting to address anti-Black racism in medicine. And so Listening to Black Californians was kind of born out of her passion and desire to do that. And so they worked with a Black-owned research firm here in LA called Avitaris to survey, interview, do focus groups with over 3,000 individuals here in California to really understand what their experience was like when they interacted with the healthcare system and what was the result of that. And so I won't spend a lot of time because I really want to make sure we have a healthy discussion. But there were a lot of in-depth interviews in urban areas as well as rural areas across the state to get more diverse input. The approach that we heard, or perceptions about health and approaches to self-care, really came to the forefront. And I think the perception about how our community really feels about their health and wellness was also very different than what was expected. And so, we as a community really want to be more proactive about our health, and we want to make sure that we are cared for by people who really care about us. And so having a community of physicians and healthcare teams that look like us is also very important. And making sure that we are able to endure sometimes things that are in our past that have been very traumatic and impact our health and well-being on an intergenerational standpoint. And so lastly, participants really expressed their aspiration and expectation around really having more patient-centered care. That doesn't always happen within the healthcare system, but we are trying to help empower our community to really understand how to navigate around that. And so I'll just quickly go through this and focus on the one thing that we are working on, and that is to really improve health literacy and focus more on community-based education to help our community really understand how to navigate through the healthcare system and how to understand how to make the healthcare system work better for them. And so what are we doing to make that happen is through the How Do I campaign, which is really intended to help individuals understand, how do I do anything that I need to do to make the healthcare system work better for me? And we created a education program last year. It was a 5-part webinar series, again, that was really focused on health empowerment. And I think the foundational learning for us was really important for people to really understand some basic things that we may not know as just general healthcare consumers. And the first thing is, the patient bill of rights. I don't think the average person really knows that there is such a thing, let alone what is included in the bill of rights. What do I have rights to? How do I leverage those rights to work to my advantage? And what does that really mean for me? Navigating through the healthcare system, again, whether it's an office-based visit, hospital stay, ER visit, or even navigating through your health insurance. How do I communicate with my healthcare provider, no matter who or what type of provider you're dealing with? And how do you make sure that you're listened to, right, and really heard, especially when you're talking about what is going on with you or symptoms that you have been dealing with? How do you advocate for yourself and a loved one, especially if you're dealing with a serious health condition or diagnosis? How do you really participate in the decision-making for your care and know that you should really be at the center of that and own that power and that dynamic and be a partner with your healthcare team or your provider? And then ultimately, we really want to focus more on prevention and disease management as a way to really begin to close the gap and see better outcomes for our community. And so we were able to work with a Black female physician who actually wrote a book that covered a lot of those 5 things about your patient rights, communicating with your healthcare provider. So I think it was very fortuitous that she came into my life and our work to partner with to do the 5-part series. So again, they mirrored the 5 things that I just mentioned. And we also recognized that, not everybody could attend a webinar in the middle of the day. So we wanted to make sure that we met people where they are. We wanted to go where people work, shop, eat, pray, play, and slay. And so we created a community-based conversation series, still focused on helping people understand how to make the healthcare system work better for them. So we created community conversation sessions, and we did one with Tia back in the room at her other place of business. So we have just general community conversations that are really structured around, in some cases, a specific situation. So for example, we worked with a group of people in Stockton last year during Black Breastfeeding Week to talk about what are your patient rights in a situation if you're really trying to advocate for yourself to breastfeed your child or your baby, but you're being steered in a different direction, like for formula. This came about because we heard a story about a woman in San Jose who had just given birth. She wanted to breastfeed her baby. The person she was communicating with would not listen to her. She was requesting a lactation consultant and was still being steered in the direction of formula. Her husband stepped in to advocate for her. Short version of the story is he ended up getting escorted out of the hospital by security just because he was trying to help his wife and advocate for her. So we wanted people to understand, well, first of all, that should never happen. But here are your rights in that situation, and here's how you communicate with someone, a healthcare professional, if this is what you're trying to make happen for yourself. And then how do you advocate for yourself in that situation or have someone there? If you don't have the luxury or benefit of having a doula, advocate for you in that situation. So we have structured our community conversations around certain situations. We're talking to a pharmaceutical company about doing some things around asthma and empowering asthma patients, and especially now after all the wildfires that happened a couple of months ago. So we actually want to work with ERG groups at different corporations. We were fortunate enough to do one with a group of financial planners at Merrill Lynch last year in Sacramento. We're going to be working with the faith-based community, so that's conversations with the congregation. I did a talk with a group of elders at a church in Oakland last year. That was really interesting, and they asked a ton of questions, which was great, which is what we want to have happen. The series that we did, or the session we did with Tia, was Cocktails and Conversations, and that's in places where there are Black-owned restaurants or Black-owned wine bars, or cigar bars in her case. We also want to do events and conversations in barbershops and hair salons, so that's Cuts and Conversations, and then Black-owned coffee bars and shops, so that's Coffee and Conversations. So again, really meeting people where they are and being in places and spaces that are trusted and known and frequented by the community. And then we were very, very fortunate to work with the California Legislative Black Caucus. I mean, it took about 1.5 years to get to this point, but on May 4th of 2023, we finally got the final vote on a resolution to declare the first week of May as Black Health Equity Advocacy Week here in the state of California. I believe we are the first state in the union to have a statewide resolution that really uplifts and stresses the importance of focusing on these issues that are impacting the Black community. So, thank you. So again, we want to make sure that our community has a voice, they know how to exercise that voice, and they can be part of solving our own community's problems. So we have a social media campaign. I'll share some things that we've done with that shortly. The message that we have focused on is we've got the power. We really want our community to know that they have the power to really, change and rewrite our health story here in California. We started a health equity advocacy training program, or HEAT, what we call it for short, because we want people to go back to their respective communities and turn up the heat and cause some good trouble. And Tia was one of our participants in cohort 2. And actually, Makai Freeman, who is virtually, participated in cohort 2 as well. So I think what we're doing is working, because we have 2 at least voices that are part of this event today who are talking about things that they want to have happen, or their experience that they've had in terms of advocating for themselves or their loved ones, and really knowing how to do that. So we take our HEAT participants to Sacramento during that first week of May to really advocate for and uplift issues that are impacting their community. So they get to put all their learning into action and meet with their state representatives on both the Senate and Assembly side. But a lot of people don't know that they have the right to go visit their representatives in Sacramento as well as in DC. And we want them to have that experience and know how to do that, know that they can do that, and know what to do when they're in the room sitting across the table from these folks, because they can play a role in influencing policy that can change what resources they get in their community, how those resources can impact the health outcomes of the communities that they live in. Again, really create a more empowered community of individuals that are taking charge of their lives in health and wellness. So just a couple of examples of some of the social media, part of the social media campaign from this past year. But again, focusing on we've got the power to make the healthcare system work better for us. The other is, we've got the power to reclaim our health. So again, this is really all about patient empowerment, and whether you have access to Navigator or not, I think it's important for us to know how to self-advocate and also navigate through the healthcare system. And so we're working really to ignite a Black health movement here in California through all of the work that we do. And so I think we're making progress, but we still have a lot of work to do and a longer way to go. But I really hope that one day, we won't be the community that has the greatest gap in terms of life expectancy, and that hopefully through some of the policy work and the partnerships and the education activities that we're engaging in, that we will see hopefully 5 years or so down the road a change in what is happening with our community across maternal health, cancer outcomes, chronic diseases, and even end-of-life issues. And so that is it for me. Happy to answer any questions. So, thank you.
Thank you so much. More inspired and more hopeful. Feeling good. I think if we have one or two pressing questions, we could take them now, but then we're going to move on to the panel. Okay, right up front. Mike's coming to you.
Thank you very much. This was wonderful. I'm Natasha Rowan with AstraZeneca, and each of the discussions today, it sounds like people have had success in getting the patients connected to the provider, and even across the diverse groups, many of those populations have the cultural distrust. And you kind of touched on it with past experiences with racism. How have you been successful in breaking that trust barrier? Can you give us a few examples?
So yes, so I'll answer it in a couple of ways. So I think that if we do our job right, and we really do create an empowered community of individuals who can do all those things I talked about, the patient rights and navigate and advocate and participate in their decision, then whatever they encounter, I say, we're not going to get rid of racism anytime soon. But I think that big R that they may experience or may be confronted with can be shrunk to a little r, and they will be better able to navigate through that situation. But I think in terms of breaking those barriers and also building trust, sometimes you need to change your healthcare provider. If that person or individual is not giving you the time and attention that you need and showing the care and concern that you need, we let people know you have the right to fire your healthcare provider. You have the right to file a complaint against your healthcare provider, as well as your healthcare plan, and this is how you do that. So that's part of navigating through the healthcare system and empowering people to really take charge of their health and wellness and know what options are available to them and what they have a right to as part of their patient bill of rights. So hopefully that answers your question. Yeah.
Super. Thank you for that. Okay, we don't have enough time to hear from everyone as much as we want to, so we're going to move along. I have the great honor of introducing our 3 additional panelists, so I'm going to do that briefly and then pass it to them to each in turn take about 5 minutes to explain the navigation model that they embrace within their own organization. So firstly, we have to my right, Jennifer Metz, who I know fondly as Jen, and I'm so happy to be back in the room with her again. She is a public health professional with over 20 years of experience developing, implementing, and evaluating public health programs. Her work with the California Health Collaborative and Every Woman Counts focuses on addressing cancer disparities among the most underserved communities through education, capacity building, and community partnerships. And you can also read more about Jen if you scan that QR code. Next, we have Consuela Johnson. She is MSN in Nursing, Leadership, and Development, CMSRN DEI in Healthcare Certified, and is a proud member of the Black Nurses Association with 18 years of healthcare experience. And she's a senior oncology nurse navigator at City of Hope. And she's honored to support the nation's most comprehensive cancer screening mobile clinic. I'm really excited to learn more about that. And then finally, we have my dear friend Veronica Arcega Barriga. She's a senior Promotores Network Manager for Visión y Compromiso. Established in 2000, Visión y Compromiso is dedicated to improving the health and well-being of under-resourced and underrepresented communities by providing support, training, and leadership development to promotoras and other grassroots community leaders throughout the state of California. So please join me in welcoming the panelists. Okay, so we're going to start a 5-minute quick little spiel. Jen, we'll start with you. And if you want to, briefly summarize your approach to navigation, some lessons learned maybe to share with the group.
Absolutely. It's a pleasure to be here today. And so I work with the California Health Collaborative's Every Woman Counts program here in Los Angeles County. And our program provides comprehensive breast and cervical health services to individuals who don't have insurance or who are underinsured. So Every Woman Counts is funded both by federal dollars, crossing my fingers, and state dollars, which come together to offer services, comprehensive services from education through to a diagnosis of both breast and cervical cancer for anybody who doesn't have insurance and who is at or below 200% of the federal poverty level here in California. Together, what happens is the state has this money and they grant it out to 10 regional partnerships to be the boots on the ground. So the California Health Collaborative actually has 7 of those contracts, and we cover everybody but Orange County, the Tri-County area, which is Ventura, Santa Barbara, San Luis Obispo, I think, and then the Monterey area. So we have individuals in each local region. We have a health educator and a clinical coordinator, along with a team of community health workers and promotoras that are responsible for providing outreach and education throughout their region on the importance of breast and cervical cancer screening, routine screening. And we work with designated EWC providers in each of those regions. So Every Woman Counts contracts with 1,000 clinics, approximately 1,000 clinics throughout the state of California. Here in Los Angeles County, we have 200 participating providers that offer our services. So we have 2 clinical coordinators responsible for providing technical assistance and training to those 200 primary care providers. And I have a team of 12 very passionate and dedicated community health workers or promotoras that work within the community to provide education and screening assistance to individuals who are not yet linked to a health system, who don't have health insurance, and who we help from the very first moment that we meet them, whether that is in a health education workshop or at a community cultural event. From the first time we meet them, we continue on, with their permission, to provide screening assistance to ensure that they don't have any difficulty making an appointment, remind them of those appointments, make sure that they went to those appointments, ensure that they receive their results in a timely fashion, and for those who need follow-up services, get those follow-up services. And then anyone who is diagnosed within our program gets referred on to our sister program, which is the Breast and Cervical Cancer Treatment Program here in the state of California. So that's kind of the structure of what we do. And I think that's a good start.
Just a little. They just do a few things. All right, let's pass it along to Consuela.
Hello, everyone. My name is Consuela. I am the Senior Oncology Nurse Navigator for City of Hope's first ever cancer screening mobile clinic program. Yes. We just celebrated our 1-year anniversary, so very excited. We have seen about 500 patients. We have screened about 500 patients within that year. Basically, what my role is as a navigator is to follow the patient from the beginning to the end. And unlike my peers, when they see patients, they already have the cancer diagnosis. I'm working from the screening process, going over what that entitles, what the mammogram is going to feel like, what to expect. Then if they get abnormal results, go over what our next steps are. Let me hold your hand. Let me walk you through the process. Until if they need additional follow-up, let them know what that looks like. And we're not just washing our hands after the screenings. We are following them through every process. And making sure not only following them, that they understand, that they're educated, that they have, that they ask questions. I want them to challenge me. If something doesn't make sense, I'll explain it over until it makes sense to you, and to you to explain back to me, in your words, what your next steps are. We partner with federal qualified healthcare centers, along with employer groups. So we go out to different employer groups who are interested in our program, and we are literally and figuratively meeting people where they're at their job. So they don't have to take off, from work to go get a mammogram or skin cancer screenings. We partner with JWCH clinics, and we help them screen their patients for mammograms. We also help patients find primary care providers. There's a lot of patients, and I think there's a assumption, oh, they got good insurance, they have a primary care provider. There's so many people who don't have providers. So my goal is to step in, ask those questions, why don't you have one? What's important to you? What do you look for in a primary care provider? And let me assist you on finding those resources. I also kind of bug them when they go for diagnostic screenings. Kind of like borderline stalking, but hey, you got your appointment? Okay, this date. Let me call the facility. Let me make sure that they actually have all the records. This is the person I spoke with. When I call the facility, do you have everything? Are you sure? Is there anything that you're missing on our end? And then follow up, did you go to your appointment? Okay, then go over the results with them and answer any questions for them. We are equipped with a nurse practitioner, a mammogram tech. We have a registered nurse on board as well, in addition to myself, as well as other support staff. So we're basically like a miniature hospital on wheels. Yeah, so I think that's it.
Incredible. Thank you. And lastly, we're going to hear from Veronica.
Hi, everyone. First of all, I would like to recognize promotoras in the room. Who are promotoras in the room? Promotoras, community health workers. Oh, Olivia, Rosa, right there. Thank you. Thank you for being here. The second question that I have for you is, who is not familiar with the promotora model? Yeah, who is not familiar with the promotora model?
Yeah, a few hands.
Okay, a few of them. So I want to say that the promotora is a member of the community that lives in the community, that has that understands the needs of the community and really looks for the change that that community needs. So they are not only coming to make changes, but they're part of that community. So that's a big difference. And they might be connected by lived experiences because they live them by themselves, or because they have someone next door that are fighting with some situations. I'm very happy to hear, because I am a promotora that has been as a promotora for more than 25 years in the community, and I have seen the systems in Los Angeles County, state of California, and beyond. And I'm very happy to see that today the conversation was around understanding the social determinants of health. That's a big flag for the community and for promotoras since ever. We have, as Visión y Compromiso, trying to educate organizations, universities, and others of the importance of understanding the social determinants of health. If you want to design a program that is effective for the community, you really need to understand those barriers that the community has. One example, I was in another state, I don't remember exactly where it was. We were in a conference, we were talking about the oral health. And one of the presenters said at that time, oh, the community do not have interest in their dental care because they missed appointments. They miss appointments because sometimes they have barriers, childcare, transportation, and they had to work. They don't have permit to miss work. And for them, it's priority to really work every day to have enough money to bring the food to their home and the rent. So understanding the social determinants of health is key. The other thing that we are doing as promotoras or Visión y Compromiso, we are really being the voice of the community in different settings. We are part of the Health for All campaign. We're part of the Food for All campaign. We're part of the Housing for All campaign. We are part of the Oral Health for All campaign, and you name it. Because we as promotoras need to be part of the conversations of the different programs that are being discussed to bring to the community. Very important, the promotoras do patient navigation as well, but beyond doing the patient navigation, they do walk the walk with the community. In many cases, we hear promotores saying, our community members do not want to go to see the doctor to follow up on any program that they are integrated on because they're not feeling well, because they don't have anyone to take care of the children. So they go, they talk, they connect them with the resources, but they explain the resources. I think it's very important to see that it's not only about talking about cultural and linguistical appropriate programs, but really to have people that understands the culture, that speaks the language, that understands the connection, why I eat bread and coffee every morning instead of a healthier breakfast, because that's part of the culture, and we need to transform that. So Visión y Compromiso does a lot of that, and the promotoras as well, and also we do advocacy work. We bring the stories of the community to the policy changers. We ask them to share what they are living. It's not Visión y Compromiso. It's not only the promotora, it's a community as well. We connect them. We make them to really express the needs that they are having. Not what we are thinking that might be a good program, but to fit what they are needing. What the most important role of the promotoras is that we create an egalitarian relationship with the community. We don't feel that we know more than them. We use popular education to educate the community because they are the experts. The community is the expert. The promotoras get to know the community because the community trusts on them. They are the bridges between the community and the services, the community and the universities, the community and the programs. And we have seen promotoras transforming the communities when we do not have a result. In the past years, Visión y Compromiso partnered with UCLA in adapting a curriculum on colorectal cancer to make it effective, to make it appropriate for the promotoras learning. The information might be great, but the way that we transmit information might not be the better. So we as Visión y Compromiso, we have learned how to really communicate with the promotoras, utilizing that education, popular education, and actually adapting those needs to the curriculum. We right now are partnering with City of Hope as well on training promotoras on the different type of cancers and really understanding how the promotoras can help navigate the community on those different type of cancers. I think I saw your face. I don't know if I might time myself.
Every time I meet with Veronica, she says, promotoras love to talk.
Yeah. Yeah,
I let her
so sorry. I saw your face. I don't know if I'm
No, I would love to keep hearing, but I want some time for discussion, and I want some time to hear some questions from the audience. So I hear this theme across all of you about empowerment, education, but also meeting people where they are, and really taking the time to listen to people and address the pressing needs that they bring, right? So sometimes it might not be that health screening test that is the thing that we're trying to promote, right? Really trying to recognize the whole person, the whole family, the whole community, and what those wide range of needs are. So not an easy question, but how do you kind of in your work and within your organization kind of navigate that challenge where there are this host of pressing needs? I heard you all talk about, social determinants of health, bringing the van to people's work, trying to reach all of those things. But sometimes, it's not going to be whatever the health issue is that we're working to address, not going to be the individual's first priority. How do you manage that?
No, I was going to say, you guys are on the front lines every day.
Okay. prior to coming to Sea of Hope, my background was in acute care at Huntington Hospital. So I dealt with a lot of patients coming in from, different walks of life, different, just tragic things that have happened. My way of navigating it is recognizing it and calling it out. I'm not going to ignore I can't expect you to follow a treatment when you're worried about who's going to pick up your kids. I can't expect you to listen to what I have to say when you are worried about your lights getting shut off. So listening to my patient, getting to know them for who they are, not just a patient in the bed, listening to their stories and actively listening and not pushing my agenda on them. And recognizing, okay, you may need to put this on a back burner, but we need to circle back around to it. And what does that look like for you? Do you have a plan? Let's sit and create a plan together on how we're going to do this. And then following up with them and, not holding them accountable, but I got you. Let me figure out how I can help you, how we can do this together. If I can't do it, let me connect you to the person who can do it or who can give you more resources. And just not leave people at the wayside.
I echo that. I think meeting people where they are and identifying those barriers is first and foremost. And also recognizing that there are steps along the way, as was presented earlier. It might be that somebody had a bad experience with another provider. So helping them to identify where they can go. While we are the Every Woman Counts program, we do actually provide screening assistance and navigation to anyone that we encounter in the community. So it's not just specifically for us. So we do a lot of education on knowing that you can fire your healthcare provider, you can get a second opinion, you can find somebody new, and how to do that. So oftentimes, yes, it's identifying what those barriers are and listening. This is not a quick process. Some individuals, yes, only takes 1 or 2 phone calls and we can, their goal is met. There are other individuals that 3 years later, we are still talking to them on a weekly or monthly basis, still making baby steps along the way. And so not having a preconceived notion of how the process is supposed to go and meeting each individual with that dignity and the respect that they need and providing the resources we can within the limitations that we also face, it comes to that mutual understanding and respect.
Yeah, I think for Vicente Compromiso is key just to use integration instead of inclusion. Integration is more really be part of the same round table and listening the needs of the community. And especially having that cultural humility, not putting our bias and understanding the needs of the community. And always using the popular education. That's what we always do. For us, it's more important to create awareness than just education. Education cannot transform by itself. But if you create awareness and it kicks something on your gut, you will do the difference. You will go the extra mile to make the changes that you need.
Perfect. Thank you. Rhonda, did you want to add something?
No, they're listening.
Okay, perfect. Well, let's open it up to the audience. I know everyone's getting hungry, but let's have a few questions before we go break for lunch.
Hi, well, thank you so much for all that you have been doing all morning, actually. And this panel is particularly wonderful. I'm Lourdes Baezconde Garbanati, and I'm a distinguished professor in population and public health here. And I just really want to commend you, especially with the Promotoras model. It's something that we utilize. But I want to tell you a reality that we face, especially when we're writing grants. We need to show now innovation. We need to show how we are moving even beyond some of these wonderful models that we know work really well to show that innovation. So I'm asking you, what suggestions might you have of those methods that you've been utilizing to really show how innovative and new they are, how you may be working with new technologies and new systems? I mean, I love the mobile band thing. That is terrific, because, we have to show that when we write for grants. And so we have the significance, we have the models, but how do we move beyond that so we are more and more competitive each day?
I can start. And that's so true because working, Vicente Compromiso, working with so many other organizations that integrate the Promotora model, that's the usual talk that we have, how we show the powerful model that is a Promotora model in transforming communities. And I think getting together and really sharing the stories and sharing the transformation that community is having is one piece. I know that in many cases, they want the data. So right now, there is a bill on the California legislature that is proposing to evaluate the Promotora work and community health worker work around that medical program, and to present a report every year on the impact of that work that work is having. So that bill is AB 403. It's just right now there. So that's, I think, one of the first steps that can collect data officially of the work of the promotoras and community health workers across California. So just be aware of that.
I'll, second that. It is data. Data drives numbers. It drives change. Being the first mobile clinic, we have experienced, a lot of trials and tribulations and learning, but definitely for us is getting adequate data collection. Right now, it's kind of manual. So getting a system in place where it's not a manual process.
And I think for us, I'm just going to build off of and not repeat anything. For us, when we're writing grants, when we're asking for funding, when we're suggesting new programming, I think one of the ways that we've been able to stand out from others is that, yes, we will go to a health fair if we're available, but we would much rather be somewhere else. Because typically the populations that are willingly signing up and going to health-related activities have already understand the importance. They're there, if not to get that mobile mammogram, they're there to get the stress balls, the pens, right? We're looking for opportunities to find individuals who don't yet know to ask where they can get a free mammogram or need a mammogram. We're looking for folks who don't realize what the cervical cancer screening guidelines are. So that for us looks like going into non-traditional spaces and places to find people. Rhonda mentioned, cuts and conversations. It's a great example of something that isn't widely done, but has been done over the years in different ways to engage stylists who oftentimes have a very captive audience for a few hours in their chair to talk more than just about the tabloids, right? Finding opportunities to educate folks where they are, but not necessarily in a health identified space, is really important. And I think that's how we use our community health workers and promotoras the best, is to empower them with that opportunity to find individuals in the community, like really in the community to speak to. And so trying to identify those places and spaces where we can go beyond just health fair participants or individuals who voluntarily come to a health-related workshop.
And I'll say, if you're thinking about doing something different and innovative that can change the game, that's not always easy, but I know that technology can, it's not. But, and so technology can play a role, and I think from a funder's perspective, looking at, I know a lot lately, looking at collaborations. Different organizations have core competencies. One organization can't do everything. So how can you build sort of a coalition or develop partnerships that can have a greater impact than you can have alone? And then how can you maybe leverage technology to scale up what you want to do to have greater impact too? Because, funders are looking at return on investment, just like lots of other organizations. So if you're focusing on doing something different that may not have been done before, I think that constitutes maybe somewhat like innovation. So, but yes.
Thank you. I wrote down eat, work, play, pray, and slay. That was innovative to me. Took it up a notch. All right, next question. Oh, come on, y'all. Perfect.
Hello, my name is Alexander Cantres. I'm a student at USC. I'm doing a dual degree in pharmacy with a master in healthcare data analysis. And the question that I will ask, it will be for everyone basically as well, for the panelists and the previous panelists as well. I've been thinking that there is a variable that's being left outside, or I haven't heard at least, of coming from the perspective of, have you considered in doing collaborative or collaborations with the pharmacy, the community pharmacies? I feel a lot of the patients, they always goes first to the pharmacy because they're trying to save as much as they can. And as a healthcare provider, when you are contacting directly to them, especially, for example, I speak Spanish and they feel comfortable just approaching to me because I look like them and you know, I speak their language as well. I think that in that moment I can also, or pharmacists can also, within the scope, approach some points such as like, hey, you should go and visit then a healthcare provider like a physician, oncologist, or what steps should go, or what other assessment we can go and show them as well. So what are your perspective in terms of that? And if you have done any collaboration with that, which collaboration?
We have not, but I think you just gave her an idea for innovation, so maybe, yeah. I don't know. Anybody?
We have been successful in the past collaborating with pharmacies on a statewide level. I would say at least 12 years ago, though, when our program was more well-funded. We would have promotions that we would run in conjunction with pharmacies during Breast Cancer Awareness Month and Women's Health Month and that kind of thing, and they were wildly successful. We used to document, our 800 number used to document how people heard about us, and we know that that was very successful. Our funding is limited at this point in time, so we haven't been able to afford that type of outreach, but I know that I work on a local level with a few that do help us along the way. So Lourdes, that's a good thought.
For the mobile clinic, we have not had that opportunity, but I think that's a great opportunity. Jessica, that's my manager back there. I hope she is writing that down. From my past experience, I have had the opportunity of collaborating with pharmacies. For instance, if I had a patient who didn't have insurance and couldn't get their medications, we had a grant where we were able to write off their medications and pay for them. So I believe, you know, it takes all of us, right, together to make sure that our patients and our community is getting what they need.
Go ahead.
Yeah, with Visión y Compromiso, I don't recall that we had directly worked with a pharmacist, but we are integrating to the research projects, and one of them is to integrate more clinical Latinos into the clinical research, and that's one of the things that we are doing. But we had to acknowledge that medicines, is a taboo for our community. Or you use a lot of it, or you don't want to use any at all. So I think there is a lot of a big room for learning for promotoras and for the community to really see it as a friend and not as an enemy, and maybe to adopt materials that can be more how do you say this? More easy to understand for that community, because just to say the name of the medicine is complicated.
All right, and I know Rhonda had a thought. We can close it out with you.
Yeah, building on what she just said. Yeah, we were at one point, because we do some education around the importance of our community participating in clinical trial as part of the equation to close the gap in health disparities. And we were thinking at one point about partnering with, I think CVS bought a clinical research organization, and they were setting up enrollment sites at different clinics in certain neighborhoods and communities, using it as a way to educate about the importance of participation in clinical trials and also enrolling patients. But the leadership changed and that program kind of got defunded, so we didn't do it, but that was one opportunity that we could have pursued. So.
Great, thank you. So one more time, if we can thank all of our panelists. Yeah, not only for sharing with us today, but for the amazing work that you're all doing all the time. And I will step out of the way. Do you want? Okay, I'm supposed to mention that we're going to go to lunch now. So that's what we're going to do. Everyone enjoy lunch. And please take the time to, find us and we can talk some more about these innovative partnerships and moving forward.